Hello, so this is Dawn, and this is my case presentation. So to begin with, to provide some background information about the client whom I'm working with, she is a young female college student. She is 22 years old. She is Latina. She, in terms of her family structure, she is the oldest daughter of three girls. She has a younger sister in high school and another sister in middle school. Both her parents are still married, and she is from the Salinas area over near Monterey, Watsonville. She comes from a low-income migrant family. She's a first-generation student, like I mentioned as well. Neither of her parents went to college, and in fact, only, I believe, her mother finished high school. Both grandparents on both sides still live in Mexico, although she has a large extended family of aunts, uncles, and cousins, also in the Salinas and Watsonville area that she remains very close with. So that's a little bit of her background and history. She has I would say minimal family support, in the sense that her parents weren't very supportive originally of her attending college, as neither of them ever had, and really thought it would be best for her to just go to work. She did work in the fields with them growing up on and off, doing seasonal labor, and is often requested to come back to do that, although she doesn't do it very often. She works 20 hours here on campus in addition to going to school. She has decent finances in terms of she has a healthy financial aid package that helps subsidize her living expenses in school, as well as working part-time. So it's a little bit of background on her. How she came to work with me was that she was a self-referral. I had been working with one of her sorority sisters, as I am the staff advisor to their sorority here on campus, and so I've actually known her in an informal way for the past couple years, because she's also a student in the Educational Opportunity Program where I work, and like I said, I'm the staff advisor for her sorority. I had worked with one of her sisters who had been struggling with some depression and anxiety issues last semester, who I still work with, and so she referred her to me. To highlight her perception of her problem and what brought her to me was that she has been suffering from some general depression and anxiety over the past semester plus a few months. She has started to withdraw from friends and social situations and spends a large amount of her time secluded in her room. She sleeps many hours a night and day, on average around 12 hours a day, when she is not at work or participating in some sorority events. And after several sessions of us working together, she finally was able to disclose that she feels like this is a result of a sexual assault that happened to her about 6 months ago. So since then, she's become withdrawn, depressed, incredibly anxious, suffering from panic attacks when in social situations, which has also led to her binge drinking, which I think she identifies as her primary problem and concern, as she is now disclosed that she's drinking to the point of blacking out every time that she drinks, which is at least 2 to 3 times a week. She's drinking to the point where she blacks out and then is waking up still intoxicated for a few hours before going on to be physically ill, including vomiting and sick, and not really being able to eat or drink very much for the next day or so. So this is what she came to me with her concerns, with some of the depression, anxiety, and for her most disturbing was her blacking out from drinking. Some of the strengths of this client, because I did really do a strength-based assessment when we were working together. I thought it was important to lead with that because she was full of a lot of shame and a lot of guilt about her situation. So I did a recovery model strength-based assessment with her to really look at some of her internal and external resources. So in terms of her internal resources, like I mentioned, she does come from a very disadvantaged background. However, she's shown herself to be incredibly resilient. She has, since junior high, been very good about accessing and utilizing her resources through school, such as Upward Bound type programs, working with tutoring and working with extracurricular mentors to assist her in pursuing college. Here at the university, she participates in the Educational Opportunity Program actively in meeting regularly with her academic advisor, attending study skills workshops, attending tutoring. In addition to being the president of her multicultural sorority, she also holds officer positions in 2 multicultural organizations. So she has excellent leadership skills, she has excellent organizational skills. She definitely is a strong peer mentor to her sorority sisters and to other students. So she has those leadership skills and that resilience. And in spite of her current emotional and mental challenges, she still has been showing up to those events. I would argue that she's stretched really thin, but I feel as a part of her background as a Latina, with a lot of the research emphasizing that they tend to place an emphasis on the community and the group rather than the individual. That's definitely what motivates her, because her biggest concern about disclosing to people some of her challenges is that she doesn't want to burden others. And so she definitely has a lot of empathy and compassion for others, and she very much, in alliance with her culture, is about the importance of the group versus the individual. I do consider that a strength of hers, although we're working on prioritizing her self-care as well and how that will help the larger group. So again, she's incredibly resilient. She has excellent leadership skills. She has a strong support system. She has a healthy living situation with 3 other roommates who are all also in her sorority. 2 of them are aware of the fact that she was previously assaulted and have encouraged her to seek support, and so that she does have the support from her immediate living situation. So that's definitely a good strength of hers. And again, she has faculty and staff mentors who she works closely with, who also have expressed concern for her and are trying to encourage her to take care of herself that way as well. In terms of additional methods of intervention and prevention that I have utilized with her, I've also worked with her really from trauma-informed in practice perspective in what's been highlighted, I think, in some of the articles we read in class and the night articles about just really trying to normalize her response to her assault, and that the feelings that she's having are to be expected and that they're normal, and helping her understand the impact that that's having on her emotionally and mentally. That's difficult for her because very common in what she shared in her family and with a lot of Latinas is that they have already some trouble navigating being sexual beings and being okay with that. So then when a sexual assault occurs, that creates a lot of shame and victim blaming, and she's struggling with her culpability in her assault. She does not want to disclose or really get into the narrative about the assault itself. So I've definitely respected that and continued to, again, work with trauma-informed practice with her, of not focusing on the underlying event and traumatic event itself, but more talking about the present and the here and the now and the impact that it's having on her present day and her anxiety and her moods, and how she has developed this understandable but unhealthy coping mechanism of drinking to the point of blackout in an effort to free up. So just trying to, help her understand that. So, because she's really confused as to why she feels the need to drink to the point of blackout. I've also Then doing some CBT, or cognitive behavioral therapy, with her in terms of really challenging the automatic thoughts that come up for her around why she is becoming more reclusive from friends, withdrawing from social situations, and a lot of her fears. She's taken to leaving town on the weekends whenever possible because she doesn't trust herself to be able to stay here. And when faced with invitations to go out, the automatic thoughts that come up for her, and that she's going to get herself into a dangerous situation, that she's going to drink till blackout, till something bad is going to happen to her, or she's going to damage some friendships. Really working on some of the meaning making around that and replacing those thoughts. And I actually even used the worksheet that was provided to us in class as a homework exercise with her, and that has also been really helpful. She often gets confused and has a difficult time articulating her thoughts, and gets disoriented, and sometimes doesn't know just a simple next step to know how to cope to get throughout the day. So some simple homework I've given her as well is tangible task-oriented things, in terms of her living space has become symbolic of her internal chaos, in that she talks about how she grew up in a very structured environment, doing chores in a clean room, and now her room is completely disheveled, and there are clothes and food and laundry everywhere, and it's a mess. She can't even see the floors. And so a couple times I've given her a very concrete task of within the next hours you need to leave, go, make your bed, start with a clean slate, put laundry piles around the room, clean off the whiteboard in your room, and write in the next 2 days' homework. Just very concrete, tangible tasks for her to do, and then I have her offer me some proof of that in taking pictures with her cell phone and texting those to me within 24 hours, and that has been very helpful with her. She really likes that concrete guidance, and it's really helped to build her feelings of self-efficacy and self-worth, because she's able to complete a simple task, because she has, for all intents and purposes, stopped going to class and stopped performing academically, so that causes her a lot of stress. She feels a lot of pressure to push back on the stigma and the stereotype of a Latina, in that she's going to end up, being pregnant and having a baby and just getting married and dropping out of school. So she's feeling a lot of pressure around that and those expectations and how it's impacting her. So really working around the meaning making of that. However, her leadership role in her sorority is a strong motivator for her, and really feeds her desire for change right now, because she, again, that whole cultural idea of the group is more important than the individual, and she is the president of her sorority, so she feels a strong motivation to improve her grades, to get healthier, so that she can really be that leader for her other sisters and not put her sorority in jeopardy of getting in trouble with the university. Some current theoretical models that I feel like drive some of my work with her definitely is, system theory approach and sort of ecological theory, in terms of it's really about her utilizing the resources within her environment to help with her healing and help with her process. And she has shown historically that she's good on drawing from her social supports within her various systems, of both within her family and her cousins, as being a social support, and also within her system here at the university, in that larger system as a student, accessing those resources, and the subsystem of her sorority, and the resources that are there for her in terms of support and healing and getting better, and in that leadership, and that she has a responsibility not only to herself but to others to really move forward. However, I would argue that this is complicated by the system and the culture of the university and college life, because I think it's heavily steeped in rape culture, and how that's constantly a triggering presence for her in some of the misogynistic behaviors of students, the sexual objectification of young women out socially, the silencing within the Greek system that she's a part of in terms of sexual assault, because there's a lot of silence within that community in order to not compromise other chapters, to get in trouble, to lose their status, because of different historical things that have happened here on campus. So I think although there are supports within that system, there are also challenges within that system as well that are in conflict with one another. So again, we just do a lot of work on replacing some of those negative thoughts, really talking about how the trauma is impacting her, and being very solution focused with her in terms of setting very short-term concrete goals for her to accomplish, and doing a lot of grounding exercises, breathing exercises, visualizations, and positive mantras when she feels herself starting to escalate into a panic attack, and that has turned out to be very helpful for her. The theoretical model of my agency is a bit different from others because we're not a mental health provider here within my program, the Educational Opportunity Program. However, we work with, I would argue, the most diverse student population on campus. So we're very aware of how family systems impact our students' performance here on campus, and so really supporting her in how to navigate her family system and ask for what she needs in terms of support without feeling the burden of having to disclose her assault, because she feels that that would be re-traumatizing for her and for her family and may compromise her ability to stay here at school. So really supporting that understanding and that cultural competence piece, and empowering her to take care of herself, with the understanding that if she can thrive and heal and do better, it will benefit her larger family structure by her getting her degree, getting gainful employment, and lifting her family out of poverty. And also being able to act as a role model and mentor to other Latinas here on campus to seek healing and help, as counseling and that sort of thing are very stigmatized within that community. So really the model of my program here on campus really supports that, as well as we exercise an intrusive advising model in that, from day one when our students here, we ask them to disclose a lot of information about their background to try and help them integrate into campus life and address any areas of conflicts that we think may come up for them. So that is my current situation with her. We, like I said, I give her regular homework assignments. We meet every week. She's been very good and consistent about coming in to see me. Again, she really enjoys the CBT practices that we have and the homework and giving that feedback. And again, that's really started to build with her self-esteem. And now we're working with her through a behavioral assessment team with both some practitioners down at our campus alcohol and drug education center to help do some psychoeducation with her about her drinking, as well as trying to get her to consider participating in a sexual assault survivor support group here on campus. But as for right now, we're talking about maybe doing that on a smaller scale with her and a couple of other of her sisters who have similar backgrounds. So I'm showing positive results with her. We've been meeting for about 3 months now. So I look forward to everyone's feedback, and thanks.